My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and vice chair in the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team and am the host for Emory's COVID-19 videos where we talk about important topics during this pandemic. Today, I'm very pleased to be joined by Dr. Colleen Kraft. Dr. Kraft is a professor in the Department of Medicine in the Division of Infectious Diseases and a professor in the Department of Pathology at Emory School of Medicine. She is also the Associate Chief Medical Officer of Emory Hospital. Welcome, Dr. Kraft, and thank you so much for joining me today.
Always happy to join you.
Thank you. We're going to quickly look at COVID-19 numbers before we get into our topic for today. Cases do appear to be down across the United States, though daily averages remain more than double last January numbers. Deaths continue to increase daily and are up 35% from last week. Death rates are higher than at any time in this pandemic other than last January, where currently we are having daily averages well over 2,000 lives lost every single day in the United States. Hospitalizations appear to be reaching a national peak, and 99% of the country is in a county with high transmission. New York and New Jersey, two states that were hit very early with the Omicron surge, do appear to see cases dropping, and they are roughly at only 2/3 of their early January peaks this year, while some states have not yet reached their peak. So we do want to be careful about looking at national averages. With many people testing themselves with at-home tests and other infections going undetected, reported cases are certainly an undercount of actual infections, but they do indicate how the virus is spreading across the United States. Today, we're going to be talking about testing, and we're going to focus on at-home testing. Most people are now familiar with the terms PCR test and antigen test. Each of these tests has places where they work better and times when we need to be more careful with their interpretation. So that's what we're going to be talking today with Dr. Kraft about. We're going to start with antigen tests. Antigen tests are now available to be sent to each address across the country. So let's begin with these at-home, easy-to-use tests. They are called antigen tests or rapid tests, and they are different than our PCR tests because they test if someone is contagious at the time of the test. So we're going to talk through the specifics of what that actually means. So we're going to start with Dr. Kraft. What are these tests actually measuring?
Right. So we don't know exactly what each one is actually measuring because that is actually proprietary for each of the companies that have made these tests. And for a list of these tests and their sensitivity and information, you can go to the CDC website and look up antigen testing, and it'll give you a very long list of what is approved under EUA. Or you can actually look up if you're in a store or you brought some home, you can actually go to the FDA website and see what they presented to the FDA and learn about what they are detecting. But most of them are detecting sort of the antigen, which is like sort of a piece of the virus that's shedding or that's created by the cell as the virus has infected the cell. And so it's sort of like a piece of the virus that is on the outside of the virus usually. So like the nucleocapsid or other parts of the virus. There's also some tests that detect more than one part of the virus, which is going to be very important as we talk further about how these work under different variants.
Yeah, and they do work a little bit differently under different variants. And we're going to get to some concern that was originally out there about whether or not they worked during Omicron. As we stick with how to use these tests, and I know you and I both have some to show, if I have a known exposure, when am I best to use my antigen test that I have at home?
Right. So I don't think that in general for exposures, this is a great test. So I think it's something if you're not having symptoms to use these types of tests, you have to make sure we're sort of in a peak time, which we are right now, and it's okay to use it at that time. But otherwise, you may not get the results that you want if you're just testing yourself when you don't have symptoms. So I think for exposure and no symptoms, sometimes that's best to go somewhere and get a PCR test so you can be absolutely sure that you don't have the virus. Otherwise, if you don't have symptoms and you're not sure, this test may not be the best test for you.
So if we think about day 0 being the day that you have an exposure and you contract COVID, at what point in time in your length of infection will these tests start to work?
Right. So usually it's going to be, sort of 5 to 7 days, and it depends. So despite Omicron having such a short incubation period, it still was detected a little bit later because it took people a couple days to sort of get their viral load up, or their antigen load up high enough. And yeah, sorry.
I think it's really important to make sure that we hear what you just said, because if I had an exposure yesterday and I take an at-home antigen test today, that's really not going to be able to detect whether or not I have contracted COVID-19. We want to make sure that people then don't take that test and say, well, I'm negative, so therefore I'm fine, and not continue to monitor for symptoms or receive a PCR test.
Yeah, so the downsides of antigen tests in general are that they are not sensitive, meaning they're not going to pick it up on the first day that you might be, your virus might be infecting you, right? So they're not going to be exquisitely detecting everything that you have in terms of COVID infection. The other, so it can be a false negative, is what we say in the laboratory world. You can be falsely reassured that you don't have COVID if you test too early, or if you just don't have enough virus in your nose or mouth that can be detected. The other negative thing about antigens, or the ways that it should be used, is that right now we're in a time of surge again. When we hopefully come off of this surge and we have much lower prevalence in the population, much like we did over the summer of less than 0.1%, these actually can be tricky in that they can falsely give you a positive result in a time of low prevalence, which we'll also talk about a little bit more. But antigen tests have a very narrow window of use, and I think they should be used if you have symptoms, and they should be used at least 5 to 7 days after an exposure if you are trying to detect the antigen in your nose and mouth.
So if you've had an exposure and then you become symptomatic, this is actually a really nice place to use these tests, right?
Absolutely. Yep.
Okay. So let's compare them for a moment. So antigen tests at home, they have a more narrow window where we want to use them, but that window is perhaps slightly better if you're symptomatic. Let's compare them to a PCR test, which is really the gold standard and what we have all been using for several years now. So by contrast, PCR tests look for genetic evidence of the COVID-19 in a sample. So how does this give us different information?
Right. So what PCR does, and there was a Nobel Prize around PCR, so it's pretty interesting if you want some nighttime reading, is that it takes that genetic material and it looks specifically for it with something called primers. And when it finds that, then it amplifies that up. So that's why we call them more sensitive, because it can actually detect sort of that needle in the haystack. So that's sort of what I call PCR test. That's the needle in the haystack test. So you can find it. You can also be, very, very, very sure that you don't have COVID if you have a negative PCR test, because it is looking sort of very, very deeply in that sample.
And I think when I'm going to ask you in a moment about how do you interpret a positive antigen, how do you interpret a negative antigen, but I want to hallmark what you just said. You can be really sure if your PCR is negative that you don't have COVID. And so that is a good thing to know about that kind of test. How quickly after exposure can we be pretty sure that a PCR test is going to work?
So that one I'm okay with you getting, sort of 3 to 5 days after your exposure. So you should, especially during Omicron, which has that short incubation period, you should be able to sort of see that ramp up in your viral load. And again, it's going to be able to find it even if it's sort of amplifying in your nose and mouth versus sort of needing to be at the peak amount, which is where an antigen test works the best.
Let's move to using antigen tests, and we've got a couple different kinds. I've got an Abbott Buy Next Now. You have one, yeah, you have it Buy Next Now as well. So suppose I am using it in the right time period. Is it fair to say that this is kind of a snapshot of, am I contagious to someone else?
Right. And so in general, antigen tests, we haven't used them a lot. We do use them sometimes in doctors' offices for influenza testing or different testing. It does actually work quite well for the contagiousness aspect, because in order for your antigen test to be positive, you do have to have a lot of virus. So remember, we just talked about sensitivity, where a PCR test is very sensitive and antigen test is probably, 10 times less sensitive. But COVID has a ton of virus once it causes infection in you, even if you don't have symptoms. And so that is where it's useful, which is there's still a ton of virus. So that's why we say less sensitivity is better, because if you're triggering a positive on an antigen test, that still means you have a ton of virus in your nose and mouth. And so we have been using that as sort of a surrogate for contagiousness. Now, the caveat to that, Jody, is that these are going to be different. So I don't work for any of these companies. I don't have money with any of these companies, but each one of these has different sensitivity. And so that's the kind of information, if you want to compare, types of sensitivity between each test, that can help. Now, I will also say that these aren't universally available. You don't get to go to the store and choose, which one you want and look on the FDA website. Usually you're just getting whatever is available in the store at that moment. They probably have roughly the same sensitivity. There are some that are worse than others, but if you're triggering a positive during a surge time, you most likely have COVID. It's going to predict that you have COVID and that you're contagious.
And I think that that's super important to make sure, again, we kind of highlight that if you have a positive test on an antigen test, it is very unlikely to not be accurate and not be telling you correctly that you are contagious to someone else. And then we know what to do about that. You need to make sure you're in isolation and you're wearing a mask if you need to be around others when you're outside of isolation.
Exactly.
So a lot of the way we've talked about using these antigen tests currently, again, assuming you can find access to them, is to consider how to gather safely. And this became a conversation we talked a lot about, especially right before the holidays. But let's continue that. Let's talk about, if I want to get together with a few people for a dinner, but someone in this group has a condition that makes them immunosuppressed, or there's a young child there who cannot be yet vaccinated. How do I best time my antigen test to make sure that on the off chance I have COVID, I am not going to spread it at a small dinner party?
Yeah, so there's a couple things to remember. First of all, you got to think about your own exposures. So getting ready for that dinner party takes some lead time. So I'm visiting my 98-year-old grandmother in hospice who has not been vaccinated because of the hospice protocols. So I'm going to think about all the things I'm going to do a couple weeks, at least a week, before I come up to see somebody who has who's very vulnerable. So there's mitigating your risk, right? So you're not going to be doing other things in advance of being at that party, in case you have an asymptomatic case and you could still spread it. The other thing you're going to do is, if you have symptoms, you probably shouldn't go, even if your antigen test is negative. So I wanted to put those two caveats around the dinner party conversation, because these are ways we can actually have fun and be around people, but we can be confident and not just rely on a single point of care test to get us to that party. So mitigate your risk. We all know how to do that. If you don't know how to do that, still go to the CDC website and it'll tell you. So masking, not being in enclosed places without masks. Really, everybody needs to be masked, et cetera. This is not for this discussion this morning. So mitigating risk and making sure you don't have symptoms. Because if you have symptoms, you actually still may have something else, like influenza, like rhinovirus, like metapneumovirus, that you could spread to your vulnerable friends. So let's avoid that. So in terms of timing before your dinner party, I would recommend doing it as close to the time of the dinner party as possible. So let's say you're going to go in the evening. I think testing that morning is a good idea, or testing the night before, especially if you are making plans and you need to make something for the dinner party. You probably don't want to do it the morning of, because you would have already purchased everything. So I think it's a good idea to, test the night before or the morning of, depending on the practicality around the logistics of the get together.
Very good. I do. So again, I'm going to pull up the antigen test that I happen to have at my house right now. Again, not suggesting that everyone needs to get this particular variety, just happens to be the one I currently have, and I've used multiple others. This comes in a pack of 2. And so when they were a little bit easier to find, and there has definitely been a run on antigen tests, I liked to use one the day before I might gather, and then one immediately before, but that is 2 tests in order to gather safely. And that is for everyone who's going to be part of the gathering. And so at the moment, people may not be interested in using 2. And so closer to the timing is going to be a little bit more of an appropriate time to use that test if you don't have the luxury of using 2 of them together.
Right, but Jody, you just exactly, if we had your class here and we could ask questions, why would Jody use 2 tests over maybe a 12-hour period?
Yep.
She's trying to increase her sensitivity of the test. That's actually why a lot of these say test twice, because antigen tests are notoriously insensitive, as we've talked about. And so testing twice increases the sensitivity of an antigen test. And it's not just COVID antigen tests, it's all antigen tests. So that is actually a great scheme to do that. Again, if you have the luxury of having 2 tests and you want to use 2 tests, you've increased your sensitivity by testing yourselves twice.
Yeah, the possibility that I would have a false negative 2 times in a row really is statistically not very probable. So you're exactly right. That's exactly A, what I would teach in a class, and B, why we want to use it that way. Again, knowing that they do cost money and you are using 2 tests for every one person. So imperfect in opportunity for sure. If I test positive on an antigen test, again, just to highlight this, I will feel very comfortable that I am contagious to someone, and I need to make sure that I am not then proceeding out into the public and that I have a mask on at all times. How common are false positives with rapid antigen tests? Because I've just said, if I have a positive, I'm going to assume that I'm contagious. Is there a chance of a false positive?
There is a chance of a false positive, but it's almost not going to happen during this time when our community prevalence is about 20%. So this is another thing that Jody would teach in her class, is about how prevalent the disease is in the population and how that helps our diagnostic testing. So during the time when there's a run on COVID antigen tests, that probably makes sense because they will be very useful during a time of high prevalence. Now, in the summer, when I think about traveling to the national parks, and if it was very low prevalence, then there is a possibility, and sometimes it's a high possibility, like 1 in 2, that if I get that false positive, that there's a high likelihood that I would be false positive. But in general, right now, especially during the winter months, and during this COVID Omicron surge, we definitely would trust a positive result. And again, that's the other reason you can do multiple ones over time, is to see sort of what that trend is.
Very good. All right, there was some conversation at the beginning of the Omicron surge that our antigen tests may not pick it up and that they would not work as well with this particular variant. A couple of new studies have come out where I'm thinking of one particularly in California, where they tested everyone with a PCR test. They also did a timed antigen test, at that exact same moment. And they found that they were very, very good at picking up Omicron. Do you have any doubts that these do not work well during this particular variant surge?
So I'll try to keep my cynicism to a low, but people that make things that are sold in stores are going to want to test these things or understand whether or not their tests work in the population. So my response to all of these different surges we've had in different variants is I want to know 2 things. Does my test work? And what are the therapeutics? Are the therapeutics going to change for that variant? So those are the things that you should be thinking about as these things roll through. Does my test work? And do I need to do anything different for therapeutics for COVID? So this is usually going to happen where we have academic medical centers or some companies basically test side by side with PCR to see what the detection rate is. And so those types of things are always going to be, there'll be a little bit of a lag. There'll be an uncertainty at the beginning of a surge of a variant, but eventually that will be sorted out. And I have no concerns that what we're looking at pick up Omicron very well. The other thing about Omicron is it's just creating a lot of virus. In its transmissible, and that's part of the reason it's so transmissible. And so I think, we also are just getting a ton of virus, and it's fairly easy for antigen tests to work right now.
So kind of a silver lining to be able to use antigen tests for Omicron. Another thing, and I hesitate to promote this, but I actually want us to make sure we talk about it, so we're giving really good information. There have been some headlines that suggest that instead of using your test in your swab in your nose, the way these have been studied and the way they are approved under emergency use authorization, to actually swab your throat instead. What are your thoughts about using this kind of off-label method of using an antigen test?
Yeah, so my preference, I guess, and as the purist laboratorian, is to really just stick with the anterior nares and just really you don't have to do the brain biopsy, but just really do a good swabbing of just the inside of your nose really well. That should be adequate. That is, part of where COVID lives in our bodies. I think the throat swab is, something that can be used, and I think we'll be evaluating it more and more. I think the issue is it's harder for people to swab their throats, and so they're not going to get as good of sampling in their throats, and that would just be the downside to sampling the throat. So yes, we think that, as part of the physiology of where COVID lives and us swallowing and all that kind of stuff, that throat is going to be a great place to sample. I just think it's harder to sample for some individuals.
Yeah, I would agree. It is, we had to get used to sticking this in our nose. Sticking it in your throat is a pretty different thing. And again, I want to say to everyone watching this, they've not yet been well tested for that. And so that is not how we want to use a test, where the data has not been well collected and examined by experts in the field. Let us put a fine point on how to interpret a negative antigen test. That's a little different than interpreting the positive antigen test. So positive test, pretty cut and dry. If you have a positive antigen with this level of spread in the community, you should feel very clear that you are contagious, and make sure you mitigate your connection with other people during that time. A negative test is a little bit more nuanced to it, and perhaps it's a better way to think of it is, what it's telling you is it is unlikely that you're currently contagious with COVID-19, as opposed to telling you do not have it. Am I interpreting that correctly?
I think that's a safe way to interpret it. So we're not, you can't totally say, like the needle in the haystack PCR test, that you don't have COVID. So if you're using it to test your exposure, or your asymptomatic self before a get together, that is, you need to have that caveat of, I still probably need to be careful just in case, this is a potentially false negative, or it just hasn't caught my infection, or I'm not shedding enough virus yet to make this thing positive. So that's how I would sort of interpret that.
Okay, so we want to be a little bit more careful with that. And if you're asymptomatic, that becomes an even more, more of an issue to consider. Because antigen tests are not going to be the best test at all times of an infection, let's talk about the CDC guidance with quarantine and isolation, and which tests to use best in each of these situations. So as a reminder, the quarantine guidance does differentiate based on vaccine status, and if you have yet had a booster and are in the right time to have gotten a booster. If you're unvaccinated and beyond, or beyond 5 to 6 months after your primary series of a vaccine, you're going to fall into the same category for quarantine, which is, if you've had a significant exposure, you should quarantine for 5 days at home, and then you should test on day 5 or day 6. And if that test is negative, wear a mask for the next 5 days when you're out in public. What kind of test is the best test to use during this time? So in a quarantine situation for a person who's not vaccinated or is not yet boosted.
So that would definitely be fine with an antigen test, because they're going to not have a blunted response, because they're sort of they're not really, they don't have the antibodies left to sort of fight the infection. So it should be fairly robust if there is an infection. Again, in order to, if you really had a strict, like if where you're going back to had a very high risk for other people, and there's some reason you couldn't wear a mask, then I would even consider a PCR test, but I don't want to make it too complicated. I think antigen tests in general to sort of get out of isolation, or, I think about the get out of jail free card, but get out of isolation free or get out of quarantine. I think they can be useful. They just really need to be used as the CDC indicates. And I think it's, I'm always really a practical person. And so I think it is hard in some areas to get a PCR test. In some areas, it's hard to find an antigen test. And so trying to figure out, sort of what you need. But that needle in a haystack PCR test, if you're in outside of the window where you've been exposed and it's negative, you can feel pretty good about that result. But if you're planning on using antigen tests, you should still use what Jody suggested, which is that you continue to make sure that you're not going to spread asymptomatic COVID.
So now let's assume that I am a person who's had a positive COVID-19 test, and the CDC guidance says that after a 5-day isolation period, if I am not symptomatic at that point or have not been symptomatic the entire time, I can leave that isolation and then continue forward in public with 5 days of strict mask wearing. The CDC does not require a test to leave isolation at that point in time, but other countries have. And for example, the UK uses a test at day 6, an antigen test, and then it needs to be followed by another negative antigen test at day 7, and they need to be separated by a full 24 hours for that to count. Do you think an antigen test is good to use here at this point in time to make sure that you're not contagious to another person?
Yes, I think this is a great use for the antigen test. So if we already know that you've been positive, then we can sort of gauge, sort of how quickly this is basically gauging how quickly your antibodies are clearing virus. If you happen to be COVID positive if this is an isolation scenario. If it's a quarantine scenario, then it's sort of the same thing. It's really going to be a measure of contagiousness in individuals that have been vaccinated.
Okay. And another thing that I get questions about all the time is, but I've had a positive PCR. I do not want to test again because I've been told that I will continue to test positive for up to 90 days or 3 months. But let's be clear, that's a PCR test that we're talking about there. That is not an antigen test. So can you help us walk through that a little bit more?
Right. So remembering that needle in a haystack test is the PCR test. So it's going to find, even if there's dead virus that's still being cleared by your body, it's going to find that virus. So we don't recommend, if you've had a positive PCR test, to do anything on the other end to define clearance, right? So at that point, we go a lot by symptoms, and we're going by this recent CDC guidance that especially vaccinated individuals can clear this virus a lot sooner, which is why they also don't have severe disease. And so an antigen test is a great test after a PCR to sort of get you out of isolation and to determine whether or not you still have that amount of virus that can be contagious, that you have enough virus to basically trigger an antigen test.
And I think, I would be most comfortable making sure I come out of isolation having had a negative antigen test, but I'm going to be particularly careful about it if I am then in a position where I'm around people who are going to be more vulnerable, to make sure that I'm not spreading it to them. So an antigen test after a positive COVID test and going through your isolation, and antigen test is the place to look for a test result.
For sure. And I get really pragmatic about these things, probably too much so. So when I have people that are asking me this question as an individual, which they do daily, I try to figure out what they need it for. So if you work from home and you don't interact with people, you may just want to isolate or isolate for 14 days or 10 days, whatever the true isolation time is. So some of these things rely on what you're going to do next. So in the healthcare system, we are always masked. So we, try to bring people back at 5 to 7 days if their antigen test is negative, because that actually helps our workforce and gets people back to work. But knowing that we're in a risky population, but we also know we completely mitigate that risk by mask wearing at all times. So I think a lot of it, I don't want to make it too complicated by saying it's just going to depend on your situation. But some of this is nuanced. And I think that empowering people to sort of understand, like, if, like my niece needs a negative antigen test to return to school where they don't mask. That makes sense, right? So, if she has COVID and she tests positive by PCR or antigen, now that PCR or that antigen at 5 to 7 days is still positive, she shouldn't go back to school because nobody's wearing masks at the school she goes to. So these are the sort of scenarios where you say, well, if I have a positive here at this time, well, I'm going to be entering into an environment where I'm going to spread it. So it really needs to be a negative antigen test, or it needs to be to the end of her sort of prescribed isolation time.
And I think that just like that scenario is super important to understand and to think through. It's also really important to remember that if you are still symptomatic after day 5, your isolation period by CDC guidelines does not say go back out into the community, even with a mask on. It says to continue to isolate up to day 10. So symptomatic is one of the more easy things to make sure that you remember to continue to isolate, and an antigen test is not needed at that point in time.
Exactly.
Let's talk for a moment about your niece and her school, because I do want to touch briefly on how testing works in schools. We're working so very hard to make sure that we put everything in place to be able to keep children in schools and children and staff and faculty safe while they're in schools. What are your thoughts on using regular COVID-19 testing algorithms in school systems?
Yeah. So, again, Jody, I'm sorry, I always get really, really practical about these things. So, depends on the cost of them, depends on what you're trying to use them for. So I know that that's sort of hedging and not really answering your question. But I think in some areas that we can't guarantee that there's, 100% compliance with masks, I think probably regular testing also is a form of accountability to individuals. If they know they're going to be tested, then they're going to at least be thinking about my actions sort of have to prevent the spread of COVID. So I don't know if that's helpful to you.
Yes.
I mean, I know there's studies about these things, but really every study is going to also encapsulate sort of what the risk is for those individuals. In healthcare, we have started to do some antigen testing for people, both to just check them if they're having symptoms, or to help them have a return to work ability if they can't go out and buy it themselves. That's the type of scenario that I think really helps. So in my children's public high school, they're doing some regular COVID antigen testing. I think that's useful. A lot of those families aren't going out and buying these. It's sort of as a service to the community in some ways to sort of check on that, especially during this current time when it's so prevalent. If you're picking up sort of those asymptomatic cases, then you're going to be kind of lowering the community viral load by not having those individuals in that population coming to school every day asymptomatic with COVID. So I hope I've tried to encapsulate sort of my thoughts on what is kind of a nuanced situation. So if it can be done, if it's done consistently and well, and privacy of the patients or the students or whomever is preserved, I think it's a service to the community if it can be done.
Very good. That was very helpful. Thank you. As we wrap up today, I want to provide a few reminders about some additional services that are available. First of all, everyone can now go online and order up to 4 rapid antigen tests per address in the United States. It's a pretty simple place to fill out, and you can get these tests at www.covidtests.gov, and they will be delivered by the United States Postal Service to your home. I filled out my application form. It's very simple and straightforward to fill out, and I am anticipating mine arriving, I hope, soon. And so we really urge everyone to take advantage of being able to get some of these tests and have them in your home. And secondly, I want to, on behalf of Dr. Kraft and all people who are working in the hospital and healthcare systems, I want to remind everyone that the emergency room is not a place to go for your COVID-19 test. Please recognize that the healthcare system is incredibly overwhelmed. If you are sick and need care, that is the place to go. But Dr. Kraft, do you have anything else you'd like to add about not using the ERs for testing?
Please don't use the emergency department to go get a COVID test. We are strapped. We are looking at a long haul of the quality of our healthcare going down because of people leaving healthcare, and just being crushed all the time is very tiring. So you can help by either going to a community place that's doing antigen or PCR testing, or if you can afford it, please purchase your own antigen tests. But do not go to the emergency department unless you feel terrible and you think that you may need hospitalization or some sort of emergency intervention. But please do not go there to get tested.
Well, Dr. Kraft, thank you for everything that you are doing. Thank you for talking through tests with us today, particularly highlighting antigen tests, which are being more used across the United States. And there's a very good place to be using them. For everyone watching, thank you. And please continue to stay safe. Please remember, a vaccine is your biggest protection against COVID-19. If you've been vaccinated, getting that booster is really important. Your mask continues to play an incredibly big role in protecting you and those around you and those you love during this high level of spread with Omicron. And antigen tests and PCR tests continue to be a very good way for us to both measure spread of COVID-19 as well as to know when you can gather safely. Please stay well and stay safe. Thank you.